When you think about America's most pressing public health crises, what comes to mind? Perhaps chronic illnesses like heart disease, cancer, or diabetes dominate your thoughts. However, there's another epidemic lurking just beneath the surface, an intertwined and rapidly growing challenge that devastates individuals, families, and communities alike: the dual crises of drug addiction and mental health disorders. Together, these conditions represent not only a significant public health issue but also an economic and societal challenge, one that demands urgent attention and sustained action. The scope of this crisis is staggering. According to the Substance Abuse and Mental Health Services Administration, SAMHSA, more than 21 million Americans aged 12 and older currently struggle with substance use disorder, SUD. Meanwhile, nearly 57 million adults experience a diagnosable mental illness annually. Among these individuals, approximately 9 million face a dual diagnosis, a condition in which both a substance use disorder and a mental health disorder co-occur. Unfortunately, these overlapping conditions often create a vicious cycle, where untreated mental illnesses fuel substance use, and addiction exacerbates psychological distress. This cyclical nature makes recovery exceedingly complex without proper, integrated treatment. The alarming rise in drug overdose deaths highlights the urgency of this issue. In 2022 alone, over 106,000 Americans succumbed to drug overdoses, a grim record driven primarily by synthetic opioids like fentanyl. However, these fatalities only scratch the surface of a broader crisis. Millions of others grapple daily with the consequences of addiction and untreated mental illnesses, which manifest as chronic health problems, financial hardship, strained relationships, homelessness, and stigmatization. Understanding the relationship between addiction and mental illness requires a closer look at the science. Addiction fundamentally alters the brain's reward system by flooding it with dopamine, a neurotransmitter that regulates pleasure and motivation. Over time, the brain becomes dependent on substances to produce these euphoric effects, reducing its natural ability to experience joy without them. Simultaneously, mental health disorders, such as depression, anxiety, PTSD, and bipolar disorder, disrupt the brain's capacity to regulate emotions and stress. Left untreated, these conditions often push individuals toward substances as a form of self-medication. For example, someone dealing with untreated PTSD might use alcohol or opioids to numb emotional pain, inadvertently developing an addiction. Conversely, chronic substance use can worsen existing mental health conditions, trapping individuals in a devastating cycle that's incredibly difficult to escape without professional help. This crisis is deeply personal for millions. Consider Amy, a high-achieving college student who started using prescription stimulants like Adderall to cope with untreated anxiety and academic pressures. Initially, the medication seemed to help, but over time, casual use evolved into dependence. She eventually lost her scholarship, her mental health deteriorated, and her relationships crumbled. Or take James, a military veteran who developed an opioid addiction after being prescribed painkillers for a back injury. Struggling with untreated PTSD, James turned to opioids for relief. His increasing dependency led to job loss, estrangement from his family, and eventually homelessness. These stories are all too common, transcending socioeconomic, racial, and cultural boundaries, proving that addiction and mental health disorders do not discriminate. Despite the growing prevalence of these issues, access to effective treatment remains alarmingly insufficient. One of the most significant barriers is stigma. Although public awareness campaigns have made progress in framing addiction as a disease rather than a moral failing, deep-rooted misconceptions persist. Many people avoid seeking help out of fear of judgment, isolation, or negative consequences in their personal or professional lives. Structural barriers compound this stigma. According to the National Institute on Drug Abuse, NIDA, only about 10% of individuals with substance use disorders receive the treatment they need. Rural communities are particularly affected by a lack of access to qualified healthcare providers, while urban areas face overcrowded treatment facilities and affordability challenges. The U.S. healthcare system's fragmented nature exacerbates these issues. Addiction treatment and mental health services are often siloed, forcing individuals with dual diagnoses to navigate separate systems and providers. This lack of integration frequently leaves patients untreated or undertreated, with their conditions worsening over time. Financial barriers are another significant challenge. Even with insurance, the cost of comprehensive treatment, including inpatient care, therapy, and medication, can be prohibitively expensive for many families. Certain populations are disproportionately impacted by the addiction and mental health crises. For instance, communities of color often face systemic barriers to accessing high-quality treatment. Black Americans, in particular, are less likely to receive evidence-based therapies for substance use disorders and are more likely to be incarcerated for drug-related offenses. Native American communities also face alarmingly high rates of addiction and suicide, driven by intergenerational trauma, economic hardship, and limited access to culturally competent care. Similarly, LGBTQ+ individuals are at elevated risk for addiction and mental health issues due to societal stigma, discrimination, and higher exposure to traumatic experiences. Addressing these disparities requires targeted interventions that prioritize inclusivity, equity, and cultural competence. The financial implications of this crisis are staggering. Substance use disorders alone cost the U.S. economy over $740 billion annually, encompassing healthcare expenses, lost productivity, and criminal justice expenditures. Mental health disorders add another $300 billion in lost earnings each year. However, these figures fail to capture the human toll, the lives lost, potential unrealized, and relationships destroyed by untreated addiction and mental illness. Despite these daunting challenges, there is hope. Advances in treatment modalities are paving the way for more effective care. Integrated treatment programs that address both addiction and mental health simultaneously are gaining traction. These models often combine medication-assisted treatment, MAT, using medications like methadone, buprenorphine, or naltrexone, with psychotherapy, peer support, and holistic care approaches. Harm reduction strategies such as syringe exchange programs, naloxone distribution, and safe consumption sites are also saving lives and serving as critical entry points for individuals seeking recovery. Technology is playing an increasingly vital role in expanding access to care. Telehealth platforms now connect patients with licensed therapists, addiction specialists, and support groups, breaking down geographical and logistical barriers. Community organizations and grassroots initiatives are also making a significant impact. Peer-led groups like Alcoholics Anonymous, AW, and Narcotics Anonymous, NA, provide much-needed support networks. While advocacy organizations like Shatterproof and the National Alliance on Mental Illness, NAMI, work tirelessly to push for systemic reforms, including parity laws that mandate equal insurance coverage for mental health and addiction treatment. Cultural shifts are also helping to dismantle stigma. High-profile individuals, ranging from athletes to actors and political leaders, have openly shared their struggles with addiction and mental illness, inspiring others to seek help and normalizing these conversations. Educational institutions and workplaces are increasingly incorporating mental health awareness programs, equipping individuals to recognize and respond to early warning signs. Tackling this crisis requires a multifaceted approach. Advocating for expanded access to affordable, integrated care is critical. Supporting harm reduction initiatives, volunteering at recovery centers, or simply offering a listening ear to someone in need can make a meaningful difference. If you or someone you know is struggling, resources like the SAMHSA National Helpline are available to provide confidential guidance and support. The dual crises of drug addiction and mental health disorders represent some of the most significant challenges of our time. But they are not insurmountable. Through compassion, evidence-based interventions, and collective action, we can build a society where every individual has the opportunity to heal, recover, and thrive. Thank you for joining us in this vital conversation. Don't forget to like, share, and subscribe for more insightful discussions. Together, we can drive meaningful change.